So there are general things with the skeletal muscle you may be, oh, there's a lot. But the thing about skeletal muscles is that a lot of times, even though they have all these very complex Latin sounding names, a lot of times these names have meaning, and you can make a good stab and guess where a muscle is or what it does based on the information in the name. And some of them have like really long names like extensor carpi radialis longus, and you're like, whoa, what's all that? But actually, the longer muscle name, the more information you can kind of get from it. Okay, so this is two of the images you should definitely know, or actually the muscle list of muscles you should definitely know. So yeah, you're definitely going to have a lot of questions focused on these superficial and easy to see muscles like these. This is the bread and butter. I mean, there are way more muscles than this, but start out with this. If you don't have, these are like the basics. And this is one thing that helps me when if you've attended my lectures, you know that I really love about languages and root words and knowing how the definitions of things. So the thing is that like a lot of these muscles, they have meaning assigned to their names. Sometimes it can be a little random, but most of the time there is information. And oh, I should upload this sheet here, but this is kind of like how when I started out learning muscles, I started to kind of categorize them and group them based on the features of their name. And these are things, so like our action, what do they do? What type of joint movement do they do when you contract these muscles? And this is also on the slides as well. So there's all these sort of like root words. And do you have to know all these root words? Again, this seems like a long list, and some of them you already know, like, oh, look at this, brachial, that refers to the arm, right? And things like cutaneous refers to the skin, and femoris refers to the upper thigh and leg, oris refers to mouth. So a lot of these are the same things with our anatomical landmarks, or things like inferior, superior, profound, or deep, or superficial. These are anatomical directions. So you probably know a lot of the words on this list already. You just have to add the ones you don't know to your vocabulary. And here's the face. So there are many muscles on the face, and we're just looking at the anterior end of the head here. So what we have is a big muscle called the masseter, and you can actually feel your masseter. So it's this tough muscle, and you can notice it's toward the posterior of your jaw. And this is the masseter muscle, and the masseter is also important in chewing. So it comes from a Greek word, and so this is why if this is like sometimes it's mostly Latin, but there's some Greek as well. So massus thigh, I probably butchered that pronunciation, but that's the Greek word for chew. And then you have something called, I've heard multiple pronunciations for this, buccinator, buccinator. I mean, it comes from Latin buccinare, which means to blow a trumpet. So I think buccinator, I can see that. I've also heard buccinator, but that's where it comes from. So what happens is like this kind of helps to tense up the cheek, especially when you're exhaling or blowing something. And risorius, so this one's interesting because like I don't think there's a equivalent to this that uses this same Latin root word in English. But if you know your other Romance languages, there is a related word. So it actually comes from the Latin root word ridere, which means to laugh. So if you know Portuguese, like there's riso, and I don't know if they still do it, but in Portuguese they used to put, like my Portuguese cousins used to type in ars in the chat. That was their way of saying it, like LOL in Portuguese. And then riso is laugh in Italian, risa is laugh in Spanish, and ria is laugh in French. So they all have that laugh word from Latin. I'm not sure if there's a equivalent in English, but what does this do? When you contract this, well, look where it's located. So notice it's like the back of your jaw, and it's at the corners of your lips over here. So even though it's called the laughing muscle, what happens when you contract it? So pretend you're doing this and contracting that muscle. Does that look like a laugh to you? It looks kind of like this. It kind of looks like that fake smile. So when you're doing that kind of fake smile, because it's like stretching your lips and your corners of your mouth, but it's not actually just really doing a smile or laughing. So it's kind of interesting to call it the laughing muscle, even though when you contract that muscle by itself, it doesn't really look like you're laughing. It's kind of giving that sort of fake smile sort of thing. Okay, so but what I'm getting at here is that muscles may be named after their action or movement. So like the masseter, that comes from Greek massathai, that meaning chew, Latin referring to blowing of trumpet, and ridere, Latin meaning laugh. So these muscles are named after the Greek or Latin root word that describes what they do. And another way to classify muscles is by the amount of heads, and usually they're referring to the amount of origins that a muscle has. And here we have our classic biceps brachii. So you might be like, okay, so what does brachii refers to the arm, right? So brachial means arm. Biceps, it's the bi part of that, refers to the same thing with like in bicycle or biaxial. It means two. So the biceps brachii actually has two heads. And as you can see here, it inserts here actually has two origins. So it has the long head and the short head over here. So this is why it's called the biceps. And then why did they call it head? So the seps part comes from the same root word as cephalic. So by saying biceps, bi meaning two, sep meaning head, it means it has two heads. And they insert over here. So this is why when they contract, this pulls the forearm upwards. Now what we have here on the back and the posterior is the triceps brachii, and it has three heads. Again, tri like tricycle, three wheels on a tricycle, three heads on a triceps. So you have your triceps, the long head, lateral head, and you can't quite see the medial head in this superficial image. What you need to do is actually look at cross section, and then there's a lateral head, long head, and then you have this medial head. So this is why you can't see the medial head in this view, because it's actually tucked deep to the lateral and long head over here. So again, biceps, two heads, but again, it's not the biceps brachii because again, brachial refers to the arm. This is the biceps femoris, right? So the biceps femoris on the femur, but there are two heads. Question in the chat, do we need to know the insertions and origins of each muscle? So at this level, when you're going to 300 level, yeah, you're expected to know that, and especially if you're going to medicine. I'm not sure if nursing really, maybe if you're going to like orthopedics, maybe you need to know origins and insertions. Yeah, that would probably be a good idea. But yeah, for this class, if I test you on origins and insertions of a muscle, I will actually give you the origins and insertion. But you should know what an origin is and what an insertion is. And do origins pull toward the insertion, or do an insertion pull toward an origin when a muscle contracts? So you should be able to, if I mention origins and insertions, I won't ask you to memorize it, because again, there are, again, 600, 800 muscles depending on who you ask. And some of these muscles have multiple origins. Some of them have multiple insertions. And I think within a 2-week span, that's not a reasonable thing to expect you to know all origins and insertions. But if you're headed into kinesiology, physical therapy, or medicine, yeah, it's worth your while to know origins and insertions. So what we have here with heads, so our biceps brachii, we have a triceps brachii, and our biceps femoris. So again, it's referring to the amount of heads, and this is also coincides with the amount of origins. Again, just by these three, just the biceps brachii, you already have two origins, and then triceps brachii, you have three origins, and then it's like, okay, are we going to add layer and layer and layer of this information? Again, don't worry too much about origins insertion, at least on the 100 level. Yeah, so lab you can do like the origins insertion. Orbicularis, remember like orbit is like a circular path around something. So what happens with the orbicularis oris is that, what does oris refer to? That refers to the mouth, right? Or how about the orbicularis oculi? So remember, ocular refers to their eye. So you also have a round muscle called the orbicularis oculi, or oculus in singular, around each of your eyes. And this, what happens when they contract? Well, they narrow and constrict. So this helps in closing your mouth, or actually pursing your mouth as well, and closing your eyelids as well. And then over here, trapezius. Now, I thought this one's kind of interesting, because when you think of trapezoid, a trapezoid is what? Two parallel lines and a four-sided figure with at least two parallel lines. But it looks more like a kite from the back. And maybe people are thinking like, okay, maybe from the shoulders up, it looks like a trapezoid. But again, are these necessarily parallel to each other? I don't see parallel lines. So it's more like a kite than a trapezoid. Or maybe if you're like really yoked like this, and from the front it might look like a trapezoid, but again, I think this, when people talk about their traps and they're doing shoulder shrugs, this is what they're referring to, like this trapezius muscle over here. Now, does it trapezoid shape? Roughly, depending on which angle you're looking at, but it's more like a kite shape from the actual posterior of the body. And deltoid, I don't think there's actually a nice picture of the deltoid in either book. So I got this from, yeah, even though it says Yoga Anatomy, I thought this is a great picture from the lateral side of the body showing the deltoid. So delta refers, if you know your Greek letters, you know delta is a triangle shape, right? Same with, or if you know earth sciences, what happens at the root when you have a little piece of like land at the mouth of a river, you have that little delta, a triangle shaped piece of land. So deltoid has that same thing. It's referring that this muscle on each shoulder is roughly triangular shape. So what I'm getting at here is that we have all of these muscles and they have shapes. And if you take this muscle, now we have our we have our traps over here, a trapezius, that's roughly a trapezoid depending if you're looking at what angle you're looking at. Let's get rid of half of the trapezius, and then what we have here is a rhomboid major and minor. So what's a rhombus? Back to high school geometry, it is a four-sided figure, and it's supposed to have, like, more specifically, congruent sides, but it's kind of an approximation. Whenever anatomy is using these shapes, it's more like an approximation, not exact geometrical definition. So rhomboid major and rhomboid minor, notice that they're four-sided muscle, or there's muscles that look like four-sided polygons. So what I'm getting at here is that some of these muscles, they have shapes in their name, and this tells you the rough appearance based on geometry. So orbicularis oraculi, orbicularis oris, they're both circular muscles. And then trapezius, roughly trapezoid shape. Deltoid, roughly triangular shape. Rhomboids, this kind of four-sided figure kind of appearing muscles. And major and minor. So major, meaning in the rhomboid major, is bigger, and the rhomboid minor is smaller. Now classify muscles. So here we have direction. So this is where knowing your anatomical directions, if you're not sure of them and you're not very solid on them, it pays off a lot when you're talking about the muscles. And here we have a bunch of you might know, okay, you have your abdominal muscles, but did you know you have layers and layers of abdominal muscles? So everyone knows about the six-pack and your rectus abdominis, but what about the other abdominal muscles? Well, here we have our external oblique, and and this is actually what we connective tissue we call the rectus sheath. So what we're seeing here on the left side of this person's body is that we're actually cutting through the sheath and several layers of these oblique muscles. And what we have is the external oblique, we're cutting that and pulling it back. And then the internal oblique is another layer of muscle that's kind of actually like, so you notice that the external oblique is kind of like at a slant. So oblique actually means like at a slant to something. And the internal oblique is actually kind of like in the opposite. It's kind of crisscrossing. So it's not following the same direction as the external oblique. So if this is the external oblique in front here and superficial, the internal oblique is going to be oriented in a different direction. And then the rectus abdominis. So this rectus root word, it often means like straight. So it means like if you erect something, you're erecting something straight up along the axis. So with this rectus abdominis, notice that it's following the axis of the body in anatomical position. So it's parallel and straight and erect with the axis of the body. So this is what, when you see this word rectus, think of it being parallel with something, or something that's compared to a slant and an oblique. A rectus would be relatively straight. And transversus, so this also involves our anatomical plane. So remember that our transverse plane is horizontal. So with this transversus abdominis, it is with the transverse axis of the body, but we already have a rectus abdominis. Notice that this transversus abdominis, the fascicles are located horizontal with the transverse plane of our body. So we actually have multiple layers of abdominal muscles that help to stabilize our core and abdomen. So yeah, look at all these obliques. Notice the fascicles are not with the axis of the body, they're all at an angle over here, whereas our rectus is oriented, or transversus is oriented horizontally, and our rectus is oriented with our long axis of the body. Okay, so what we have here is that sometimes the direction appears in the front, sometimes it appears in the back, sometimes you have multiple directions. Like we have external obliques and our internal obliques, and this is referring, are they on the outside or on the inside of the body? So sometimes you have multiple directions in the same muscle's name. So this is how you're comparing these. So oblique again meaning a slant or angle, and rectus meaning straight. Okay, and then let's talk about locations. So what we have here, another view of the head and face, and we have multiple muscles, but I'm going to point out a few that talk about locations. And what we have here is the frontal belly of the occipital frontalis, and also called the epicranius. I think the two books, this is where one uses occipital frontalis, or sometimes if you're using the anatomy coloring book, it considers it a completely separate muscle. And am I going to get into that debate? Not in this class, but you may also see occipitalis. It refers just to the same general muscle belly over here, the frontal belly of the occipital frontalis, but frontal. Just like your frontal bone is in the front and anterior, this is why it's the frontal belly. Now, the occipital frontalis, that implies that it also extends to occipital bone. So this epicranius also it goes over here, it has a frontal belly, and also has an occipital belly, but it also has a thin sheet, or actually I shouldn't say thin sheet, but it has a sheet of connective tissue called aponeurosis. So it's not muscle over here, it's actually connective tissue that spans and connects the frontal belly and the occipital belly. And this is also why it's called the epicranius, because remember, epi means outer or sometimes above. And notice that this is outer to the cranium that houses your brain, right? So this is why there's two names for this, or multiple names for this muscle and the bellies of the muscle here. Now nasalis, so what does that refer to? Nasal, so the landmark, and you also have your nasal bone, so that's pretty easy. Zygomaticus minor and zygomaticus major. Well, look at this over here. What bone is it attached to? It's attached to your lips, but it's also attached to this zygomatic bone right here, so your cheekbones. So whenever you smile, what happens? One of the muscles that help you in smiling are the zygomaticus major and minor. So what happens if you have your lips here, you have your zygomatic, and then you contract it? It's going to draw it up, right? So I know that looks really funny, but if you're doing that on both ends and you're kind of doing that, you're going to smile. So when you contract your zygomaticus major or minor, it's going to help you with turning up the corners of your mouth and smiling. Now temporoparietalis, it's actually cut and reflected here and peeled up. So what it implies, what do you get from the name? Well, we have a temporal bone, we have a parietal bone, right? So we have our parietal bone over here, we also have our temporal bones over here. So this is the outer layer, one of the superficial muscles that are attached to both. And then we have our temporalis, that's attached to our temporal bone. And then we also have one of my favorite muscles called, since it has different two bellies, are innervating different. Yeah, so, that's actually a good question. So am I testing innervations for Unit 2? We didn't even get to cover nerves or nervous anatomy in this so far in the semester. So I'm not testing on innervations for exam 2. You're in the lab. And for the lab, your TAs, if they explicitly mention innervation, they can. But at this point, for the lecture exam, we're going very broad. We're just starting out with skeleton and muscles. So no innervation on exam 2. But sternocleidomastoid, one of my favorite muscles, because why? It sounds like a really long name, but the name tells you a lot. So what we have here is so the sternum. Where is our sternum? It's that bone, right, in the midline of our chest. And then our mastoid process. Our mastoid process is part of our temporal bone, and you can actually feel it. And then we also have so the cleido part, that part you might be like, wait, where does cleido come from? So cleido is actually another root word that means clavicle. So it's something that attaches to our sternum, our clavicle, and our mastoid process of our temporal bone that's behind our ear. And this is why I like this, because it tells you exactly where it attaches to. It has a long name, but if you're able to break it down, it tells you exactly where it is. And then omohyoid, so omo is it's an unusual root word. It refers to the shoulder, but it's referring to like this hyoid bone, and notice that it's wrapping toward the shoulder. So if you know, sometimes you have to add additional root words to your vocabulary, but if you already got your bones down solid, then you know that all of this is going to be, this is going to help you with a lot of the muscles that borrow their name from the bones. Yeah, so then here we have occipital frontalis, temporalis, temporoparaetalis, the nasalis, the zygomaticus major and minor, the omohyoid, and the sternocleidomastoid. Many of these muscles are named after bones. This is why I expect everyone to know all 206 bones, because again, it pays off, especially with muscular anatomy. And then we have our axial skeleton. So again, if you don't remember where the hyoid is, it's right above the larynx. And this is why our hyoid is able to keep in place, even though it does not directly articulate with another bone. Notice that there are many muscles that are named after the hyoid. Here we have the hyoglossus, the stylohyoideus, the geniohyoideus, and the omohyoid we just talked about earlier. So, and the hyoid is also connected with a lot of connective tissue as well. So you have muscles and connective tissue that help the hyoid to stay in place. It's not just floating randomly in your neck. Yeah, so notice that here's the hyoid, it's central, and it's anchoring all of these muscles over here. So we have mylohyoid, and mylo is a prefix or a root word that means molar. So notice this hyoid is going where your molars would be in the back of your jaw. And then omohyoid referring to shoulder. Geniohyoid, genio is another new root word referring to the chin. But what we have is that all these muscles that are connected to the hyoid, they have hyoid in their name. Where the other part of their name refers to another location, so one part is connected to the hyoid, but the other part of each of the names of these muscles, it refers to the other part it connects to. So the sternohyoid is going to be connected from the hyoid to the sternum. So again, this is another reason why if you don't know your major bones by now, start studying them, because they pay off. So sternocleidomastoid, my favorite, because cleido actually refers to clavicle. And if you might feel like, I don't know if they're actually doing season 4, but if you have Netflix and you watch Stranger Things and you remember the first season of Stranger Things, so what did he do in the beginning? What's his name? I just know that he's the kid from Stranger Things. But if you remember that one, the first season of Stranger Things, and what he did in the very beginning, he was able to touch his shoulders together. Well, this is why he's able to do that. These people with cleidocranial dysplasia, they don't have properly formed clavicles. So without the clavicles helping to keep their shoulders apart, this is why they're able to bend forward and do this crazy, touch their shoulders together. Just look at the first season again. I think it's one of the early episodes. But it also affects the frontal part. So this is why he also he needed those dentures to replace the bones that didn't form in his face as well. So this is why they're able to do that. This dysplasia refers to this kind of abnormal growth of a tissue. But yeah, cleido refers to clavicle. Okay, let's see, we started late. Do we want to do some top hat questions? Let's see. Oh, great. Okay, let's start some top hat questions. Yeah, let's take it easy today. It's Friday. All right. Okay, let's start top hat questions. Okay, so these type of questions won't appear on the exam because all the exam questions are multiple choice. So this is kind of interesting. This is a click on target question, and based on the quirks of the software, click on the yellow square highlighting the deltoid. So a little review of the muscles. So remember, deltoid borrows its name from delta, the triangle, which refers to a triangle shape. So where's the triangle muscle? Well, it's kind of, well, even from this angle, it looks kind of triangular. All right, let's see what people said. Let's see the heat. So most of you clicked up here, and most of you are correct. That's where the deltoid is. So the deltoid is, well, as we look at on the other side, on the right side of this person's body, it's this one on the shoulder. And again, it looks like roughly like a triangle from the side, but even from the front and the back, it kind of looks like a very flattened triangle as well. So this is the deltoid over there. And next question. Click on the yellow square highlighting the biceps brachii. Timer. Okay, so biceps brachii, again, brachial referring to the arm. So you know somewhere on the arm somewhere, right? But where do we find a two-headed or a muscle that's on the arm with two heads? So yep, most of you clicked here and most of you are correct. That's the biceps brachii. And again, this is why I have those squares, because I'm only allowed to have one correct answer for this type of top hat format. So this is why click on the yellow square. Okay, click on the yellow square highlighting the rectus femoris. So we didn't explicitly talk about this one, but if you know your muscles and if you know where, like, what does rectus mean? And what does femoris refer to? So those are two big hints where the rectus femoris would be. And if you forgot what rectus means, well, remember that rectus refers to something aligned with one of the axes of the body. So it's going to be parallel with one of the axes of the body. Okay, so this is a little tough, but yep, so where's the femur? It's going to be in the thigh somewhere. This is the sartorius over here, but the rectus femoris is actually aligned with the entire femur right here, and it's going to be aligned with the long axis of the body. So this is where we have the rectus femoris. And then next one. Wait, next question. Okay. And vastus lateralis. We didn't get to cover it, but so I'll actually throw a hint. So the vastus lateralis, well, maybe I should I think I have it in the future slides, but see if you can guess where it is. And I'll throw an additional hint. It's a thigh muscle. And it's part of the quadriceps. Now the hamstring's on the back, quadriceps in the front. I was like, that was a total brain fart. Okay. So where did people click? And most of you, so it's either people click toward the lateral side, so you're in the same general direction, but this is something called the tensor fascia latae. So the vastus lateralis is part of this group of four muscles called the quadriceps. So they're all anterior thigh muscles, and the vastus lateralis is the one that's more lateral toward the side. So this is what here. And this would be the vastus medialis is actually what these people clicked over here. Okay, let's see. What questions do I have for the next question? Oh, yeah, more matching questions. So can you match the Greek or Latin verbs to the English translation? Crazy question. Helping a friend butcher a pig tomorrow. Oh, that's interesting. Like, I mean, that I guess it's. I don't actually know too much about like our quadruped anatomy. I'll be upfront about that. But it seems like the different types of cuts for when people do butchery are also roughly based on anatomy. They just have their name for certain types of muscles or anatomy of the quadruped or whatever animal they're using. But yeah, look for the bacon bone. I know I defer to the people who do that. Okay, let's see the responses, and most of you, this is the most popular matches, and most of you are correct. So again, some of these they don't tell you the description of what they look like in the name, but they tell you what they kind of do. But again, are you going to chew with the other part of your body besides your head? Are you going to blow a trumpet with another part of your body somehow besides your mouth? Or are you going to laugh with another part of your body besides your mouth? So these all kind of tell you like some sort of information, but you kind of need to know the root word. And let's see if this one, oh yeah, this is another useful root word question. So rectus, oblique, and transverse. Let's add a bit more time. Okay, let's see what people said. This is the most common response, and this is correct. Yeah, so rectus, when you get to muscles of the eye, they're not necessarily along the long axis, but when you see rectus, there are some referring to aligned with one of the planes of the body. Transverse, again, is almost like by process of elimination, it's going to be horizontal. And oblique is often used not as a direct opposite to rectus, but in contrast to rectus. And then what we have here, fill in the blank. What is this question? Let's try it. Oh, okay, so this is another. So if you're talking about antonyms, so opposite terms, what's the opposite term from major? It's nothing major, it's only something blank. Okay, let's see what people said. All right, most of you said minor, and you're correct. So this is the other thing, and so yet another unofficial rule of muscles is that in naming muscles, if you're a root word that has a direct opposite, like major, minor, superior, inferior, so if you have one of those that have an opposite, there's typically another muscle with that opposite name somewhere in the body. So we did cover the zygomaticus major. So if there's a zygomaticus major, there must be a zygomaticus minor, and there is. Same with the rhomboids. There's a rhomboid major, therefore there's a rhomboid minor. And how about the teres major and teres minor? Yes, we also have a teres major and minor. So this is other cool things, like some of these muscles, like you get 2 for 1. If you know that one of the root words has a direct opposite term, that muscle probably exists in the body. There are some exceptions, rare exceptions, but most of the muscles that have some sort of antonym or potential antonym and opposite words in their name, they have a pair of those somewhere in the body.